Welcome to the Pulse of Healthcare. I'm Dr. John McCormick. Today I'm here with Kia. She's my lead patient advocate, works some of our most critical cases. Nurse, almost a nurse, just a few months away, so we're very proud of her. And today, this is kind of a topical discussion in today's podcast. It's something we've broached in the past. I think it's worth bringing back up. We're going to talk a little bit about hospitals as they relate to networks for health plans. And so last week we saw this article, and this happens about every 2 or 3 years, folks. Article, big headlines, Blue Cross not in network with Memorial Hermann. Tens of thousands of people are without coverage. Some people that were scheduled for surgeries are having them canceled, or they're having to pay full price, or they're having to pay some egregious deductible that they didn't have the day before.
Right.
So here they are, and stuck in this system that they bought into. They bought into this system that, I bought this plan because it had this hospital system in it, and because I was convinced that that's the best care available.
Right.
And what we talk about all the time is no one hospital or hospital system is the best care available. They all do great things in narrow spaces. Some hospitals do really great heart surgery, other ones do really great orthoscopic surgery, but no hospital or even hospital system does everything great. And then when you end up in a situation like this where you were counting on a particular system and now that system doesn't exist, unfortunately most people that are in these kind of health plans have no understanding or capacity to go anywhere else. They don't even know what to do.
Right.
And so now they're on hold with Blue Cross for hours on end, trying to solve something that they never thought was going to be an issue. And so what I kind of wanted to talk about today is, although we do have contracts with hospitals, all right, across the nation, that we don't rely on those contracts in such a way that, if one contract went away or something like that, then suddenly our members are no longer able to go to a hospital. And so the reason I wanted you to come in today is I wanted you to kind of say, we work with Memorial Hermann. We work with all big hospital systems in and around Texas.
Mm-hmm.
If you don't have and we don't have a contract with Memorial Hermann, full disclosure, all right? But can our people get seen there?
Yeah, all the time we have people. So here at Ovation Health, we specialize in an open access network, meaning pretty much any provider or any facility you would like to see, we typically contact that facility and we negotiate what we call possibly a single case agreement, or we even do bundled services. So let's say that you had a procedure that had to be done at a specific hospital and you want to, of course, continue that care with that provider, all that good stuff. We have a team here that will reach out to that facility and conduct that, which that includes the facility fees, anesthesia, all that good stuff. We can get that in a bundled rate and have that taken care of. So that's why we don't follow a specific network. We consider ourselves an open access network, meaning we would work with pretty much any provider or facility that is willing to work with us.
And see, that's really key. Any facility that's willing to work with us. And I want to be real clear about that. Our bundled service rates and our single case agreements, we're not paying less than Blue Cross or Cigna or any of those other plans. We're paying the same amount that they would pay, and in some cases more. All right? So it's not like we're trying to shortchange the hospital or give them less or anything like that. It literally has to do with that administrator of that facility, their billing people, their mindset, and their ability to work with us. Because we can pay, via claims, we can pay cash up front, so we can actually save them a lot of administrative money because we're willing to pay for something in advance in cash instead of them having to work 30, 60, 90 days, go through 2 or 3 denials from a carrier before they actually get paid. So working with us and getting that single case agreement or cash rate up front, they're actually getting paid more for less work, administrative work. Not the same amount of hospital work, less administrative work.
Eliminating the paperwork is what we call it. They go in and we call them. We have one patient comes in, needs a procedure done. We get there coordinating with one provider, their facility, all that good stuff, and that's their point of contact. We talk to them all the way through from beginning to end. And the patient is always satisfied at the end. They have the same procedure, they see the same provider, they go to the facility of their choice. But yeah, it's pretty much.
And I'm going to say most of the time. There are some occasions, they're few, but there are some where somebody's like, I absolutely positively want to go to this hospital, and that hospital is absolutely positively not working with us. And it's not that they wouldn't see the person, it's that they want to charge, 600 times what the actual cost of the procedure is. And part of our role and mission in this business with our employer groups is we're not going to allow you to be taken advantage of.
Right.
We wouldn't want you to buy a car for 600 times the price or go to the grocery store and pay 600 times the price. We're not going to let you go to a hospital and pay 600 times the price of something that we know that you can get sometimes next door or down the street,
Right.
oftentimes with the same surgeon, all right, at what is really a fair and equitable rate. Right? So you work in the hospital, right? You're
Yes.
actually you're a nursing student, you're working in the hospital, all right? What do you hear, not from the nurses, because y'all generally aren't doing benefit, verification, but when you're talking to folks that are doing benefits, what are their frustrations?
Typically, sometimes their frustration is actually just being able to communicate with the big healthcare plans. It's their cases be everywhere. They don't know who to actually contact to coordinate that care. They don't know how to coordinate that care because they have 100 different case managers on one case and things like that. I actually worked with a case manager at Memorial Hermann recently, and she had a patient. We needed to do a whole workup on her. She needed to do like physical therapy, OT after her admission, all that good stuff. But it was just hard to communicate with her insurance. It was very hard to communicate. So that's probably one of the biggest challenges that I feel like the case managers have in the hospital is trying to coordinate their care. And again, here at Ovation, we have a set team that, can do that.
One-stop shop.
One-stop shop.
And when you think about that, I've got a critical case that's going to have ongoing care post the surgery, and I'm the one trying to coordinate that care through my, admissions and qualifications and try to get all that lined out so it gets paid for because,
Right.
gosh forbid, if you don't get it, pre-authorized, then it's not going to get paid for. And now I'm not calling one department, I'm calling 6.
Yeah.
I'm not spending 10 minutes, I'm spending 2 hours of my time trying to take care of this patient. And I think that's a disservice in a lot of ways. Sometimes I beat up on the hospitals, but I think that's a disservice to the administrators at the hospital that they're having to chase, these carriers in such a way that they're occupying hours of their time trying to do something that they can take care of in 10 or 15 minutes with a plan or TPA like ours.
Yes, 100%.
So really, that's really all I wanted to touch base on today. I see those articles and they kind of jump out at me and I go, man, that's terrible. And I feel bad for the people that are involved in that contractual dispute. And all I can think of is, I wish you could break out of that Stockholm Syndrome. See my other podcast on Stockholm Syndrome. All right. And actually move to a plan that, 1, knows your name, 2, cares about you, 3, is really going to try to save you some money and guide you to the best care available at a fair rate. I don't know you can ask me any more than that.
Yeah, pretty much.
Right. Thank you so much for coming in today,
Thank
Kia.
you.